main reason for choosing this topic is all of us are healthcare professionals. And it is said, if a doctor is able to hear patient, their complaints, their sufferings, then most of the issues of the patients are solved then and there, even before starting any investigations or medications.
Welcome, Dr. Anil Jain. Today we have with us Dr. Anil Jain, and he is a very senior ENT surgeon, cochlear implant specialist, and he is also a teaching post. He is a professor and head of the ENT department. So welcome, Dr. Anil.
Thank you, sir. Thank you.
Anil sir is going to tell us about hearing and hearing losses in the various age groups, causes and etiology of that, and how to prevent that. It will be a very interesting discussion.
Good evening, everyone. I am Dr. Anil Kumar Jain. I am Professor and Head Department of ENT. I am an ENT and cochlear implant surgeon. And today's topic of discussion is measures to reduce chances of hearing loss in different age groups. Now, my sincere acknowledgements to the Dr. Preventive Academy for giving me this opportunity, my family for unconditional support, and of course to myself, because it takes lots of efforts to prepare yourself for any presentations. Now, I have gone through this particular video online. The tagline is very interesting. Anytime is good to start. The reason being keeping this image is, today itself I was quite engaged in other presentations also. I had a CMA presentation at my own institute. It was a bit national level of presentation. It was quite hectic. But the moment I got a call to present in Dr. Preventive Academy, it was a pleasure for me to accept it. And now I am here to present my presentation. Some glorious memories of last year's get together at Goa. We learned a lot over there in Goa in the mentorship of Pranav sir and Amit sir. And there were many doctors, colleagues who shared their experiences. And I was fortunate to win few awards over there, including Hall of Fame Award, Social Media Ninja Award, and One Day One Video Challenge Award. So it was a great get together for me also. Now, few more memories over there. The reason for keeping all these things are because we are here just because of efforts of the Dr. Preventive Academy. We were nowhere as such, although we are in medical field, but we are not able to make the efforts. Now, main reason for choosing this topic is all of us are healthcare professionals. And it is said, if a doctor is able to hear patient, their complaints, their sufferings, then most of the issues of the patients are solved then and there, even before starting any investigations or medications. Now imagine if a doctor himself or herself is not able to hear. Often as we are aging, the capacity of hearing decreases. But we often don't realize. When there's a decrease in vision, we often take help of specs. But when we are having decreased hearing, we are often ignoring it. And the end result is that patients are not having confidence in the consultants and they are not satisfied with their problems. So with that view, I have chosen this topic. Now, which part is important for hearing? This one. This is just an external part. And a device can be used to amplify it. Video is alive, sir?
Yes, sir.
Now imagine if a sweet music is converted into a noise, then it's disturbing for all of us. So we are supposed to be very careful to take care of our hearing, and we have to fight for noise. Otherwise, it may affect us as a plague. Now, brief introduction about the ear. It is having three parts: external ear, middle ear, and inner ear. We will not go in details of that because most of us are aware of it, but we should know that cochlea plays very important role in conversion of mechanical energy into electrical impulses, and that electrical impulses are then carried by auditory nerve to the brain. The reason for explaining these things are because most of the times we receive patients as well as doctors when they are having something impacted in the extremity canal and they are not able to hear. So one of the cause may be obstruction in the extremity canal. So we as a medical professional should be very careful to keep our own ears clean. Then there are inflammations or infections in the tympanic membrane. That may again reduce movement of the tympanic membrane. There are sometimes ossicular chain discontinuity. That is, there are bones in the middle ear which are very small, malleus incus stapes. If they are having discontinuity, then they are also impairing your hearing. So that's why I am explaining it. Now, look at these bones. There's a comparison. This is the longest bone in the body, that is femur, and this is the smallest bone of the body, that is stapes. When we keep these ossicles on the finger, compare the size of the ossicles to the finger size. So this smallest bone of the body bears all the pressure of the sound and transmits it from middle ear to the inner ear via oval window. Now, when we put earphones or loud music in the ear, it causes excessive movement of this small bone, and that may cause damage to the inner ear, and hence there may be difficulty in hearing or reduced hearing. There are two halves of inner ear, vestibular part and cochlear part. Vestibular part helps in maintaining the balance, and cochlear part helps in conversion of mechanical energy into electrical impulses. Now, so actually ear from external part appears like this, but it is having a complicated structure, and sound travels from external ear to tympanic membrane, ossicles, inner ear, then auditory nerve, then brain. I saw in the video. So ear is a funnel shape. It captures the sound waves. Sound waves are in longitudinal form. I think you are able to see the video. Now, there is a movement of the malleus, incus, then stapes. It is having a junction with oval window to inner ear. Sound is transmitted from middle ear to inner ear. Then in inner ear, there is a hair cell system called organ of Corti. And then that conversion of mechanical to electrical impulses is carried by the auditory nerve to the brain, and brain then interprets the sound, and accordingly we are able to hear it. And this all takes less than a second. The moment one talks, someone hears it and is able to interpret it. So now we have to take care of ears. We have to avoid exposure to loud sound. We have to take care that there's nothing in the external auditory canal or in infection in the middle ear. There may be different types of hearing loss: conductive hearing loss, sensory hearing loss, or it may be a mixed type of hearing loss. Conductive is when there is some defect in the pinna or extremity canal up to tympanic membrane and ossicular chain. Sensory neural is when there is involvement of the cochlea or the auditory nerve, and central type is if there is involvement of the auditory cortex. So it may be congenital or acquired. Congenital is very important and to be taken care because it can be affected by prenatal causes, perinatal causes. Prenatal means when a child is not born, there may be syndromic or may not be syndromic. Non-syndromic hearing loss accounts for about 70% of hearing loss. Syndromic accounts for around 30% of hearing loss. There may be perinatal causes. It may be due to premature birth. It may be due to fetal alcohol spectrum disorders, that is exposure of a child when he or she is in intrauterine. Means they are exposed to alcohol when they are not even born. There may be postnatal causes like some infections, measles, mumps, rubella, herpes zoster, or some other infections. There may be postnatal causes like meningitis, syphilis, vestibular sonoma, exposure to ototoxic drugs, some chemicals exposure, heavy metals exposure. Now, this is a very famous movie. I am just showing a video clip. This is, now we are having other methods of screening for hearing. We can assess hearing of a child at the earliest. Before that, we can have an idea whether there's some history of hearing loss in the family. If child's milestones are suggestive of delay in speech and language development, if there's some recurrent middle ear infections, some children may respond to many sounds but may not be able to responding to soft sounds like sha, fa. In such cases, we have to consider for screening of hearing of children. Shortly after birth, every neonate should be screened for hearing, and it is done by two different types of tests called autoacoustic emission and brainstem evoked response audiometry. Some other tests can be done by Peotone audiometry, play audiometry, tuning fork test, and some other methods. And once we get an idea whether the child is able to hear or not, we have to try to habilitate them. Now, this is a picture of one of the smallest hearing aid that is available now. It is as small as nail of the finger. This hearing aid can be kept in the canal. It is hardly visible from outside, and it is a small antenna. By holding of that, we can insert and remove the hearing aid. And if that hearing aid doesn't work, then we can use the implant called cochlear implant. So we have to identify and treat the associated disorders. We have to optimize other sensory organs like eyes for vision. We have to do auditory rehabilitation in the form of hearing aid or cochlear implants. Also, we can educate habilitation like preferential seating in the school. When someone is not able to hear properly, they can be given front seats. We can use FM system in the class for amplification of the sound. We can give speech, language, and auditory verbal therapy. We can give hearing aids. As I was saying, this is very small hearing aid that can be kept in the extraoral canal, hardly visible. There's one small antenna which helps in insertion and removal of the hearing aid. So they can be body borne, behind the ear, in the ear, completely in the canal hearing, programmable or bone anchored hearing aid, eyeglasses, and stethoscope hearing aid. Now, these stethoscope hearing aids are very useful for the professionals, healthcare professionals like doctors. Nowadays, hearing aids are available which are having Bluetooth connectivity, as well as now we are having a stethoscope also which are having Bluetooth facilities. So a doctor can use a Bluetooth enabled stethoscope which can be directly connected to the hearing aid, and they can easily auscultate their patients without any difficulty of appreciation of the sounds. Imagine if you visit a very senior physician, cardiologist, or anyone, and they are not able to hear your heart sounds. But if they use such facilities, they can very well appreciate. Of course, now there are other facilities also for assessment of heart, like 2D echo. On the basis of technology, they can be analog or digital programmable hearing aids. There may be fully digital hearing aid also. If hearing aid doesn't work, then we have an option of cochlear implants. Cochlear implants have both external part and a internal part. I'll show you pictures of both the things. Now here you can see two parts of the cochlear implant. In this previous image, you are seeing a device which is to be kept after making an incision in the scalp, and a bone is drilled to place the implant. Now this is outside the scalp and the other part goes beneath the scalp, and they are connected via the magnets. Now this device receives the sound, processes the sound, transmits it through the cable. It is having a magnet. Via the magnet, it gets connected to the receiver antenna. Receiver carries that sound to the electrode area, and they are in the cochlea. Now these electrical impulses are then carried by the cochlear nerve to the brain. So this is a schematic diagram to further explain the things. Sound is converted into electrical impulses in this device, transmitted to internal part, carried via the electrodes, then they are taken up by the cochlear nerve to the brain. So this is a patient in which you are able to see the real image, and this is a pictorial explanation of the same. Now there are different indications of cochlear implant surgery, like prelingual or postlingual. Prelingual can be those children who are having exposure to sounds, they were hearing properly, but due to some reasons, there may be prelingual and postlingual. Prelingual are those who are born deaf and mute since birth. They are not able to hear anything, so they are not having any development of the speech. So they are called prelingual. They are deaf and mute. Please remember, they are never called deaf and dumb. They are not dumb. They are very intelligent children. They are not able to hear, so they are not able to speak or communicate. Now, there may be postlingual. Postlingual are those who had initially hearing, they developed their speech, but later on, due to some trauma, some viral infection or meningitis or some other lesions, they lose their hearing. So they are having their speech, but they are not able to hear. So in such cases, again, we can consider for cochlear implant surgery. Now just watch this child, observe it. This child was operated before few years. Look how intelligent the child is. The moment a drawing sheet was offered to her, her mother offered a pen, but she refused to take it. She knew it that a color is required to color it. The moment colors are offered, she is very happy and ready to accept it and starts selecting the colors. She is looking at the picture, chooses for the right color and starts drawing. So those who are not able to hear, they may not be having speech, but they are intelligent. And so please never say them deaf and dumb. They are deaf and mute. Now, once an implant is kept, they are not switched on immediately. After 21 days or more than that, when wounds heals, we switch on the implant and external device is kept. Observe in this whether they are implanted or not. They are having such a beautiful hearing and speech development. So last but not the least, we are supposed to be friendly with our children. Other measures which we need to take is avoid exposure to loud sound, avoid water in the ear. We should avoid neglecting discharge from the ear that may be suggestive of some infection in the middle ear or maybe external canal. We should avoid any kind of trauma to the ear. It may be a barotrauma, it can be acoustic trauma. Barotrauma means when we go for deep sea diving. Acoustic trauma means exposure to loud sound. We should avoid flights when we are having upper respiratory tract infection, because we are having eustachian tube which connects middle ear to the nasopharynx. If there is upper respiratory tract infection, it causes obstruction of the eustachian tube, which may lead to problems in the middle ear. So we should avoid flying when we are having upper respiratory tract infection. We should avoid use of music while we are having flight, because when we are at a higher altitude, there is a change in pressure of the middle ear compared to the external ear. And in such cases, if you expose your ears to music or any kind of sound by putting earbuds or some earphones, that may cause damage to the tympanic membrane, or even ossicular chain damage may be there. Smoking is to be avoided because that interferes with vascularity of the auditory nerve. You should avoid self-medication. And of course, ototoxic drugs are to be avoided. That may cause sensory hearing loss. Once again, some memories of our golden moments at Goa. Thank you all for patient listening. Thank you.
Thank you, sir. Great. I saw the cochlear implant for the first time.
Yes, sir, my pleasure.
Because we don't go this much deep in the ENT, so we in MBBS level.
Actually, sir, I have restricted details in particular presentation. Today itself, we had a discussion up to molecular level.
Okay.
And our ear is actually magical. It is serving dual function of balance also and hearing also. And if someone observes, it takes nanoseconds or less than that. The moment a sound reaches ear, it travels extraordinary canal, eardrum, ossicular chain, oval window, cochlea, conversion into electrical impulses taken by nerve to auditory cortex, and then our brain interprets कि क्या बोला गया है, वो समझ भी जाता है, और फिर क्या जवाब देना है वो भी बोल देता है तुरंत. And it occurs in fractions of seconds. So such a
nature is a wonderful.
Excellent work, sir.
So basically, what I understood from the cochlear implant is that it bypasses the external and middle ear, right?
Yes, sir.
Directly gives the impulses to the internal ear.
Yes, sir.
If somebody doesn't know, if somebody is the
yes, sir.
जब अगर पहले से कोई नॉइस को या म्यूजिक को कहीं एक्सपोज नहीं है,
yes, sir.
लिंगुअल जो बोल रहे हैं ना,
हाँ सर,
तो कैसे आप डील करते हैं?
Sir, their first hearing assessment is done. After hearing assessment, we go know the level of that cause of hearing loss, whether it is in the external ear, in the middle ear, or in the cochlea, or in the auditory nerve. Auditory nerve, I will go again to that particular picture.
बच्चों की वीडियो तो बहुत ही फैंटास्टिक है सर.
सर माय प्लेजर, थैंक यू सर. मैं एक सेकंड में आपको दिखाऊंगा सर वो पर्टिकुलर इमेज, दिस वन.
ENT का कॉम्प्लिकेटेड होगा थोड़ा, आपने उसको इंटरेस्टिंग बना दिया.
सर जैसे ये डायग्राम में सर आप देख पा रहे हैं सर ना, यदि मान लो यहाँ से लेके यहाँ तक कहीं भी प्रॉब्लम्स हैं, तो जहां प्रॉब्लम उसके हिसाब से वी डू मैनेजमेंट ऑफ हियरिंग. यदि कॉक्लिया काम नहीं कर रहा है cochlea ka function, up to cochlea, the sound is in the form of mechanical energy. Now, cochlear nerve is not able to catch the mechanical energy. It captures electrical impulses because it's a nerve. So it will catch only the signals which are in the electrical form. Now the function of the cochlea is to convert that mechanical energy to electrical impulses.
Right.
Up to cochlea, the sound is in the form of movements. In the environment, it is moving air. It is in the form of longitudinal wave. Now, there are two forms of waves, longitudinal and transitional. Transitional is light wave. So light wave does not need any medium. Suppose from sun, light is reaching to us. There's a vacuum in between, but still the light is coming to earth.
Right.
But sound of that planets, बहुत सारे और जो अपने planets टकरा रहे सब कुछ, उनका आवाज अपने तक नहीं आता है, because there's a vacuum. या और सिंपल फॉर्म में समझे तो एसी ट्रेन में व्हेन वी आर ट्रेवलिंग इन द एसी ट्रेन वी आर एबल टू लुक एट द प्लेटफॉर्म बट वी आर नॉट गेटिंग द नॉइस ऑफ द प्लेटफॉर्म बिकॉज साउंड needs a medium to transmit, and that glass window does not allow that movement. So that sound waves are not entering from platform to the AC coach, but light is coming because light is transitional wave. So when sound is coming from external ear to the eardrum, it is in the form of longitudinal wave. Now from eardrum to ossicles up to oval window, it is moving ossicles. That malleus incussion step is. Now, till that it is a mechanical energy, movement of different things. After that, it reaches cochlea. There is a hair cell system called organ of Corti that converts mechanical to electrical impulses. Now, that electrical impulses are carried by cochlear nerve to the brain. So this, in those persons in whom cochlea is not working, a hearing aid will not help. Hearing aid will help only if this external ear or up to this is not working or this is working less. When cochlear nerve is working less, amplified sound is given that can be carried by the cochlear nerve. But if that conversion of sound is not there, then we implant in the cochlea that is taken by this to the brain. Now, sometimes, yes, sir.
Go ahead, sir.
Now, if cochlear nerve also is not functioning, there are many patients in cochlear nerve also is not functioning. There may be absent cochlear nerve congenitally. In such cases, there is one more implant called ABI, auditory brain stem implant, that is directly implanted in the brain stem. That is having a auditory nucleus. So now direct stimulation of that auditory nucleus is done. So it's still higher advanced. मैंने उसको omit कर दिया इस presentation में सर, क्योंकि थोड़ा ज्यादा complicated हो जाता हो.
नहीं, very good presentation, sir. Thank you.
Basic सर.
Yeah. Basic
बेसिक हमें इतना याद रखना है सर, क्योंकि हमें अपने कान में भी कुछ ऑब्स्ट्रक्शन ना रहे और हमारे पेशेंट के भी कम से कम एक्स्ट्रोवेडिक कैनाल में अगर कुछ है, immediately we should be able to just pull the pinna, look by a small device. If you feel something, please send immediately to a consultant and avoid any such. कभी-कभी unfortunately लोग forceps कान में डाल देते हैं, कई बार हाइड्रोजन पेरोक्साइड डाल देते हैं, थिंकिंग कि हाइड्रोजन पेरोक्साइड से वो बाहर आ जाएगा. अनफॉर्चुनेटली बहुत सारे पेशेंट्स में उतना वैक्स होता नहीं है और यदि हाइड्रोजन पेरोक्साइड डाल दिया, इट कॉजेज डैमेज टू द ईयर ड्रम एंड देन it becomes a grievous injury because then they have to go for surgery.
Great for taking time out and talking to all of us. You had a very hectic conference today, and still I insisted that you came, and many thank you.
Yes, thank you, sir. It's my pleasure.
Anybody wants to ask something or want to comment? Can unmute and please say.
Yes, sir. I have a query, sir.
Thank you.
Most welcome, sir.
The topic is very interesting and very
Yes.
informative. Sir, I have a few questions. Sir, cochlear implant is detachable, sir.
Yes. No, can you repeat? Detachable means what?
The outer portion, sir, that is attached to the head.
Yeah.
So during sleep, the patient will take out of that and
Yeah,
keep.
definitely.
Okay,
Now,
sir.
there are advancement in that also. As I shown in picture, I show again. Let me show you. Now, this is the picture, sir. Now, please let me your question again.
Yes, sir. That black component
Yes.
that will be attached to the head,
Yes.
skull portion precisely.
Yes.
So that is detachable when
Yes.
patient is sleeping, I suppose.
Yes.
Okay,
Now,
sir.
there are advancement in that also. This is a basic component, which is
Yes.
this is having a speech processor and a magnet part that transmits the sound. Now, there are advanced in which all these things are not there. There is only one oval shaped thing. So that can be simply kept over here, and that can be kept 24 hours. And now there are waterproof devices also. So they can swim, they can do all the water activities also. They can take shower without removing it.
Yes, sir.
Now, today itself, we had a discussion on this also. People feel like your question is very valid and very
Yes, sir.
important for larger society.
Yes, sir.
Now, believe me, we had a discussion that to learn even a single word for a newborn, they have to hear around 8 to 10,000 times before they are able to grasp it and pronounce it. Because sound has to enter, go, process, then they have to articulate with the larynx. Larynx simply generates phonations. Then they are to be taken to the articulators. Articulators are tongue, teeth, palate. So now that coordination has to develop. Whether they have to say, suppose there pa, pha, ba, bha, only lips are moving. Ta, tha, da, dha. Then tongue is touching to palate. Ka, kha, ga. Then dorsum of tongue is touching to the hard palate. So now that movement has to be learned by the child. Even a single word, it takes 8 to 10,000 exposure to sound. That's why when we see that nuclear family versus joint family. In joint family, we are having grandparents and everyone. So even though child is not speaking, they keep on talking. Beta aisa, beta vaisa, kahani sunate, and they keep on hearing. So they are having far better speech than those who are living in the nuclear family. If you observe closely, nuclear family children are having delayed development of speech. Because often both the parents are working, they go in the morning, come in the night, only maid is there, maid just make them go sleep and then enjoying her work. So child is hardly exposed to any sound, and there's a ultimately delay in speech, and that quality of speech is also deteriorating. So the more duration of wearing this device, better is exposure to sounds and better development of speech. Again, the day they hear for the first day, that is first day of their birth. Suppose we implant at 4 years of age. Then the moment this device is switched on, then they are hearing the sound for the first time. After that, they will take around 1.5 to 2 years for development of that speech language. So that patience has to be there with the parents.
Okay, sir. Sir, one more question, sir.
Sure.
Sir, what do you say about the use of earphones, earbuds?
Definitely they are to be avoided. It is as good as you must be knowing about that consumption of alcohol. पहले बोलते थे कि थोड़ी थोड़ी अल्कोहल लेने में फायदा की होती है, But recent study says alcohol in any amount is harmful. Any amount. Similarly, exposure to ears in any form, any amount is maybe harmful when you are crossing that limit of loudness. Now devices are coming with restriction ki isse zyada loudness karenge, then it is harmful. But students especially ignore that and increase that loudness. So it is definitely harmful. Just imagine that bone I showed you in that picture, that smallest bone, this smallest bone. Are you able to see my pointer?
Yes, sir.
The step is, just see the size of the bone, and every sound that you hear, every sound, be a air movement, be a fan, be a dog barking, be a horn, anything, be in your home or outside. If it is reaching to your ear, you are able to hear, means it is moving malleus, incus, and this tiny bone, whether you are asleep or awake. When you are sleeping, you are having cooler on, your fan on, then sound is going to ear also. You close your eyes, but not your ears like this.
Yes.
So it is continuously moving. You got it?
Okay, sir.
So it is already undergoing that exposure to loud, that movements. And to add, if we use hearing some that devices and loud noise. Recently, you must have heard of that sudden sensory hearing loss of one of very leading singer.
Yes, sir.
Hai na?
Yes, sir.
So now it's very unfortunate, isn't it?
Yes, sir.
So we are supposed to avoid any such exposure to loud sound, be in DJ or musical or poetry or anywhere.
अतिंद्र earphone भेज दो.
Yes, sir.
डर लग गया सर. क्या होगा?
Always prevention is better than cure.
Anybody else wants to
The
ask?
last one more question, sir.
Sure.
The tips for maintenance of ear hygiene.
Tips of maintenance of ear hygiene. Our teacher used to say, when people ask you whether to use earbuds or not,
Exactly.
or what is to be used for cleaning, then they said ki use your elbow. Means you're not supposed to use anything. Okay. At
Yes,
the
okay,
most,
sir.
just take a clean handkerchief, cotton handkerchief, wrap it on the fingertip and just wipe it. Again, I will show that picture of ear. Now, this is how ear appears. It is not straight, it's curved. Nature made it like this so that insects or ants or anything does not accidentally enters in the ear. And there are hairs in the outer part. There are ceruminous glands that secretes wax. All these are preventive measures to keep eardrum and other parts healthy. Now, when people use earbuds, part of this is cleaned, but part of wax is pushed inside. That is harmful. Secondly, the outer part is cartilaginous, inner part is bony, and there's a isthmus, that is narrow part. So when you use a earbud, it causes damage to that part. And gently there may be edema formation. So that is again harmful. Thirdly, if you look into literature, they are not actually the buds for cleaning the ear. They are made to clean the noses of infants and not for cleaning of ear. But in our country, they are sold to clean the ear.
Yes.
I have posted many videos on my YouTube channel also, that people use earbuds and that cotton gets impacted in the ear. Then they ignore that. Then it gets infected. It is giving fungus, ear discharge. Then they come. Then it becomes a complicated situation.
Yes.
And if even they come immediately also, then it costs them to get it removed. So they have to be avoided.
Thank you so much, sir. Thank you so much.
Better is, look, our ear is such a beautiful structure, and it is in this part, if you just put your finger here and move your jaw, like this. You can appreciate movement of temporomandibular joint. It is placed in such a way when we do chewing movement, when we do some talking, there's a movement, and smallest of the wax or some particles, if they are deposited, they get cleaned out. So we are not required to clean it. If there's some abnormality of the canal, then it's better to get it checked rather than attempting to do anything in the ear. Anything else, please?
Thank you so much, sir. Thank you so much.
Thanks for asking such questions. At least I could open up the discussion. I'm open for any
Hello,
kind
sir.
of discussion.
Hello, sir.
Yes,
I
please.
have a question, sir.
Sure, man.
Sir, actually, I just wanted to have an idea, like how in autism child,
Yes, please.
how is this? I mean, how to handle the hearing issues, sir?
Actually,
In case
when,
of hello,
yes, please continue.
because in case of autism
Yes.
child, how
Yes.
to handle the hearing issues, sir?
Apart from the syndromes, we have to assess for status of the hearing of the child. If child is having defects in the cochlea, chances of implantation can be taken, but usually they are avoided, because later on also that maintenance and care of implant, if not taken,
Yes,
then it may be a failure.
sir,
So
because
better in such children is augmentation.
in some cases that okay, sir.
Your voice is breaking.
Yes, sir. For me also, my voice is breaking, sir.
Yes, continue.
Hello.
Please. Continue, please.
I can't hear you, sir. Your voice is breaking, sir.
I think some network issue at your part, because Dr. Atendra is able to hear my communication. Even Amit sir is also,
Yes,
and
probably.
Pranav sir is able to hear.
You're able to speak. You're able to hear you. Please go ahead.
You just tell me, sir. I'll listen to the recordings.
Okay.
Probably some network problem.
Sure, not an issue. So whenever you are having some
Yes,
issues with development or IQ or autism, better is to take care of audiologist also and speech language pathologist. Speech language pathologists are able to assess the child, how much inputs the child is needed, and they are able to help the child to development of speech also and augmentation of hearing also. It's always better to take help of both audiologist also and speech language pathologist also. If you have any such contact, you can just send me details of the child. I'll definitely try to help.
okay, sir.
But then it depends on case to case variation.
I think she has some connection.
Any other questions, please?
Yes,
Sir,
go ahead.
Sir, there is any standards in the implants, or how do you, I mean, the second part will be like, how do you select one particular implant, or is there any electrical concerns or safety regulations, anything that needs to be followed, or
Okay, sir.
what are the
I
standards?
actually have a patient child for it. So I just
Ma'am, actually, Dr. Ravindra sir has asked a question. May I address him, sir?
Yes.
Again, Ravindra Prabhu sir, very nice question. Actually, I was expecting only basic things, but you have asked one of a bit advanced one, and nice to know that you are having interest in this. So now there are different companies with cochlear implant. In India, mainly there are three companies. One is Medel, one is Advanced Bionics, and one is Nucleus or Cochlear. They are having different types of that implants also. They provide different inner devices with that electrode array different channels, 12 to 24 channels are available. Length of the electrodes can be customized as per need of the child. Usually when a child is having deafness in birth, they are having some anomaly with cochlea. So whenever such things are there, we scan the that cochlea, we do CT scan, we do MRI, we assess for different dimensions of the cochlea. These, if you can see in the picture, there are different turns. So all the children may not be having the same turns. So we do radiological assessment of it. We look for the length of the cochlea, that breadth of the cochlea. Then depending on the cause of hearing loss, suppose a child has a congenital deafness, implants may be different. If a child born after 6 months, he or she got meningitis. Meningitis causes start of ossification of that tunnel of corti. That is there are 3 parts of cochlea: scala vestibuli, scala media, and scala tympani. So if that middle part, scala media, starts ossification, the earliest we do implantation, better are the results. And as per that patency of the tunnel, we choose the length of the implant. There are availability of the thicker implant, thinner implants, longer implants, shorter implants, pre-curved implants. So all the variations are available with different companies. So advancements are there, and you are having a right question whether such options are available or not. We are having.
Thank you, sir.
Any other question, please? Now, few more things. If you want, I'll tell some more things. There are some other implants apart from cochlear implants. Suppose a child is having ossification also of this cochlea. In such cases, we are having bone anchored hearing aid also. That is BAHA, in which implant is anchored in this bone, and there are devices which can be attached. There are middle ear implants also that can be attached to that ossicles or long process of incus. They're called vibrant bridge. So there are different types of implantable devices. मैंने सोचा उतना डिटेल नहीं जाना होगा, इसलिए इसमें नहीं रखा मैंने. Otherwise there are different things available. मैं केवल इतना ही बताना चाह रहा था कि at least as a healthcare professionals, we should know to take care of our own hearing, because when a patient comes to us and if we are not able to hear them or their complaints, how we are going to address their issues.
Actually, sometimes we go in so much of specialty and super specialty that we forget the basics.
Yes, sir. Definitely.
You can understand from the other branches also there is a lot of cross learning to be done.
Yes, sir.
Good. Thank you. Thank you, sir.
Any other queries, please?
I don't think.
Now look at this diagram again. This part is cochlea. From here, there's a part called cochlear nerve. This is a vestibular part. Again, a part of the inner ear. Are you able to see my cursor? This is a vestibular part. From here also a part of the nerve goes. That is vestibular part. And these two combines together then forms the vestibulocochlear nerve. And it is a 8th cranial nerve, that is single nerve, but it is having 2 parts. Again, a sensory nerve. It carries sensation from vestibular part and from the cochlear part. And both gets together as a vestibulocochlear nerve, takes sensation to the brain, takes that maintenance of the body balance as well as hearing. So it is such a delicate structure, and how much careful we should be of our ears. And of course, it is one of the special sense organs.
Fantastic. Once again, sir.
May I add one more thing, sir?
Yeah, please.
Now, the hearing issues are mostly gone unnoticed. When we are in a train, we are in a flight, in market or any place. If someone who is not able to hear even passes by you, you don't appreciate whether he or she is having some problems. If someone is having visual challenges, we can appreciate from far away कि he or she may need help. We just offer कि cross करा दें road, सीट पे बिठा दें या कोई direction दे दें, because we appreciate कि उनको दिख नहीं रहा है. He or she is not able to see, blindness. But if someone is not able to hear, हमको नहीं पता चलता. We are not able to appreciate until unless we interact with them. Then also first time everyone says क्यों सुनाई नहीं देता क्या? We never appreciate कि he or she may not be actually able to hear. So agony of a deaf mute person is hardly noticed by other persons compared to some other sufferings. किसी का पाँव नहीं चल रहा है, किसी का हाथ नहीं चल रहा है, we can always appreciate. But if someone is not able to hear, we are not able to appreciate until unless we see them communicating or we interact with them.
They are doing a silent struggle.
Yes, sir.
Great.
So-
Pankaj, is asking, is there any device for neurosensory hearing loss?
Sensory hearing loss, definitely there. All the devices for augmentation of sound, they are helping sensory hearing loss. Different types of hearing aids. I have shown that list of hearing aids. All these can be used. Different types of hearing aids like body bone, behind the ear, in the canal, completely in the canal. Then there may be programmable hearing aids, eyeglasses type of hearing aids. Different types of hearing aids can be given. And as I shown in first picture, this is a very amazing device. This one. This is a like a headphone. It is born anterior to the ear and it transmits sound as good as when you wear in the ear. It's having very good quality of sound, music, everything. So such things can be used.
There is a problem in articulation, then whom to consult and what test to conduct?
Articulation means articulation of sound.
Yeah.
Yeah, then in that case, first we have to consult the ENT surgeon, get examination of oral cavity, tongue, palate. Sometimes there may be that tongue tie. There may be submucosal cleft palate. Submucosal cleft palate means palate is having a cleft, but it is covered by the mucosa. So it is not seen. So that can be assessed by examination. So definitely a ENT surgeon's examination, thorough examination has to be done. Examination of laryngeal framework has to be done. Endoscopic examination of the larynx and vocal cords movement has to be done. And after that, speech pathologist's opinion has to be taken. They can help in that speech therapy and voice therapy.
To open up the discussion and it has more informative.
Definitely, sir.
Thank you, sir. Thank you, Adi.